Right now, I would like to introduce our presenter. He is a certified industrial hygienist for ICW Group. For 25 years, he has been on the front lines in private industries, working from the factory floor to the boardroom to create and implement cost-effective solutions to employee exposure challenges from chemicals, noise, and other workplace agents. I'd like to present to you ICW Risk Management Technical Specialist, Glenn Ingraham. Glenn.
Hi there, Gio. Hey, thanks very much for the intro, and thanks everyone for participating. It's great to have you on. Today's webinar, we're going to talk about respiratory protection and some of the things, the challenges that employers face in implementing respiratory protection and how to avoid some of the common mistakes, things that get people in trouble. Respirators are an excellent tool to use to help in the workplace, and it's just real easy to fall short of the expectations of the things that are required for those respirators to do what we want them to do. So that's what we're going to talk about. It starts with understanding the value of respiratory protection. And this particular statistic talks about the many, many people who can be exposed to hazardous materials in the workplace, possible carcinogens that can lead to long-term problems. When we see people diagnosed with cancer, it's very likely that the sources, the agents that led to that cancer were experienced 10, 20 years ago. Cancer can have a long latency period, and as a result, things that people are working with today can present problems later on. And it's not unusual for someone who's been diagnosed, for someone to an occupational physician, for example, to go back through that individual's work history and look at where they work. Epidemiologists do that all the time when they're tracing down the sources of cancer. So we want to do everything that we can in our workplaces today to help make sure that folks aren't going to be suffering problems in the near or long-term future. You know, another reason for us to really be paying attention to how we implement respiratory protection is because it's so easily cited by OSHA. It's not a difficult standard to comply with, the OSHA respiratory protection standard, but it does have certain bells and whistles that have to be implemented. And when OSHA walks in the door, if they see a process for which perhaps respiratory protection should be being used, or if they see respirators in the workplace, they're going to follow that thread. And it's going to be very easy for them oftentimes to find some of those deficiencies in how those respirators are being used or the respiratory protection program that should be in place behind those respirators. And so today we're going to talk about the costs of noncompliance. What are some of the consequences of experiencing poor respiratory protection implementation, and the impact of exposures. Why are we concerned about respirator use and respiratory exposures? And this is really the heart of it. It's the 5 most common mistakes that I see and that my colleagues see when we're working with employers on the use of respirators in the workplace. And we're going to talk a little bit about some of the resources that are available to help you make sure that you've got a robust program in place. You know, real quick before we'll talk about that here in just a second. But let's look at real quick at the violations, because when OSHA walks in the door, and if OSHA is going to cite someone for respiratory protection, it can be relatively small relative to some other OSHA violations, fines of $1,000 or more. But it's important to understand that those fines can escalate depending upon the severity of those violations. And in some cases, if an employer, and I have a file drawer with a folder full of clippings that describe some of these experiences, but it's not uncommon to see criminal charges and convictions for members of management teams or employers who OSHA can say has knowingly or willfully allowed a hazardous condition to continue to exist, especially if it has resulted in employee injury or death. So it's really important that what might seem like a relatively small issue, that is proper use of respiratory protection, that we really understand what it takes to put an effective program in place and to make sure that our employees are adequately protected. OSHA can walk in the door for a variety of reasons. They can come in because of a safety complaint. Anybody can pick up the phone and give them a call and express their concerns. They might be responding to an injury investigation. There might have been a severe injury. They're going to walk in the door and they're going to take a look at everything. And typically, if they can, they're going to be following every thread. And if that leads to citations for improper respiratory protection. They're certainly going to go down that path. And they also might be in the door as a result of a planned or a random visit. One of my clients, for example, just recently received a letter from OSHA because their XMOD, their experience modification rate, was high enough that it made OSHA's radar screen. So OSHA has knocked on their door and said, let's talk. Lots of reasons OSHA can be there. We also want to be sure, too, that we understand that when we have consequences of typically of non-compliance or serious injury, that can result in the wrong kind of headlines. And it's not unusual at all to see notifications or publicity of violations that have been levied. For example, might be $56,000 for general program deficiencies, or $62,000, or even as high as $152,000 or even greater. And again, it's not so much the fine here as much as it is the publicity, because many companies rely on their good name, on their reputation as part of their value of their organization and the products that they bring or services. And here's an example of Wisconsin shipyard, $1.4 million for exposing employees. Now, clearly this is a large operation. This is a large scale and systemic problem, but it's going to vary anywhere from those low $1,000 or so citations to potentially extreme cases like this. This is a good opportunity for a poll question. Gio.
First poll question is, before respirators can be required in the workplace, an employer must first. And ladies and gentlemen, go ahead and cast your votes. 2% had selected A, understand the airborne contaminants in the workplace. 10% conduct a hazard assessment. No one selected C, and we have 2% for qualify employees to use the respirator, and then 85% for all of the above.
Excellent. Okay, and all of the above is the answer. Before we can require them to be used in the workplace, there's certain things that we have to do, and we have to understand what they're being exposed to, and we do that by conducting a hazard assessment. The respirator has to be effective, certainly. And employees can't just be given respirators if they're required to be used. They have to be qualified to use those respirators. So all of the above. Congratulations. Thank you, Gio. So let's take a quick look at the impact of respiratory exposures. And, you know, it's straight up stuff. It's something that you all know, too. And that is that when someone experiences long-term respiratory exposures, it can result in compromised health and performance. You know, the challenge with respiratory exposures is that it differs so greatly from standard safety exposures. When we've got someone who needs a better glove because they're experiencing lacerations or cuts on their hand, that's easy to see. When we experience flying debris in the workplace, we know people need eye protection. We might give them safety glasses, goggles, or a face shield. Respirators are a little bit different. We expect chemicals to smell. So when we have odors in the workplace, when we have chemicals being used, it's not unusual at all for it just to be considered normal. We don't always recognize the potential impact on the employees of exposure to those airborne chemicals, vapors, or dusts. And so when we think about compromised health and performance, some chemicals can cause health effects in people that might make them less alert, might make them drowsy, might make them confused. And if these are operations that have sensitive tasks that are being performed, those employees could end up being a safety hazard to themselves or to others, much less to say what it might be doing to their long-term health. And if it is affecting their health, we might be looking at hospitalization, irreversible health effects. It's one of the consequences oftentimes of long-term respiratory exposure, whether we're talking silicosis or exposure to any variety of other chemicals that can result in long-term and irreversible health effects and death. And we don't have to go into that right now, but there's plenty of examples of workers whose health was so compromised as a result of the absence or the inappropriate use of respiratory protection that it resulted in their death. And no one wants to be put in that position. No one wants to have to make that phone call. So the impact is pretty clear. We've talked about OSHA fines. What about business interruption? When we have a serious incident that occurs, it can result in complete production loss. It can result in substantial revenue loss as a result of business interruption. And not even to mention the decline in morale. No one wants to work in a workplace that's considered hazardous or risky. where perhaps employees don't feel that they're getting all of the material equipment or tools that they need to adequately and safely work in that environment. And it can, as we've discussed before, it can affect the company's reputation and potential business opportunities, and it can result in costly claims. When we see respiratory exposure claims, it's not unusual in the workplace to see it affect many individuals and not just one person, because typically it's a systemic issue. We have many people working in that workplace who might be exposed similarly. You know, an important thing that I just wanted to point out too is that oftentimes in business there's that mantra of profits. It's all about profits. It's about doing everything we can to cut costs and improve profits. One of the things that Peter Drucker said is it's not so much about profits, but it's about avoiding loss. A successful business knows where it's bleeding or can bleed, and it takes steps to keep that from happening. So certainly some of the consequences that we see on the left side of that screen are going to result in business loss, whether it's employee loss or any of the other losses we've talked about. So putting together a robust program can help to prevent losses in this area. When we think about injuries and when they occur, it's easy for us to think of it in very simplistic terms. An injury happens, a person gets treated. Yeah, it's going to affect my workers' comp claims experience and future premiums. So that's not unusual. So we just kind of move from one claim to another with the idea of it being a simplistic process. But the reality is it's much more complex than that. And hopefully you see that we're building the case here for a more comprehensive understanding of the potential impact on your organization from inappropriate or inapplicable respirator use. And it starts with things like business interruption. We look at how do we get that person for medical treatment, and was this a highly skilled individual? Was this somebody who was performing a certain task that they were well trained for? How do I replace that person? Do I have to get somebody else in now and provide them with a high level of training? And what's going to happen to our productivity in the meantime? What's going to happen to that employee in the meantime? We're not even talking about what happens to affected individuals and the long-term impact on them and their families and their communities. But depending upon the nature of the accident, there might be cleanup involved, there might be equipment downtime, possible equipment replacement, and all of these other things as well. The time that it takes to manage these issues. So clearly the time that we invest up front to put together a robust program where we understand what the challenges are and what we're using respirators for and use the right ones can help to prevent all of these problems. So we're going to dig into the 5 most common mistakes that are made. But before we do, I'd like to point something out. You know, we've seen this picture now in the presentation a couple of times. An individual wearing a respirator, and it looks like some employers do a fine job of making sure that this person's got all the equipment and materials that they need. But there's a few things wrong with this picture. And one of the things that I hope comes out of this discussion today is that when you go back to your workplace, you're in a better position to evaluate, to review, to understand how effective the personal protective equipment that we give people and that they're using, how effective is that protective equipment? Is it perhaps offering the kind of protection that we intended when it was first issued? So looking at this picture, and I'm going to ask Gio. Gio, if you're available, I want to ask you to look at this and tell me what you think. Are there any issues here that if we were just evaluating the effectiveness of this PPE that might jump out at you?
Well, besides it being so orange,
Can't do anything about that.
Maybe the mask doesn't look like a tight fit, and I think maybe the facial hair could probably get in the way of it.
Ah, excellent. Good call. Yeah. And you can see a lot of facial hair here. And if this respirator is being required to be used against some potentially hazardous exposure, and we can see dust in the air down here, then we know that this person can't have facial hair. When respirators are required to be used, one of OSHA's primary rules is there's nothing between the seal of the mask and the skin of the wearer. In this case, you've got a lot of facial hair. And as you pointed out, Gio, this is a one-strap mask. And one of the questions I often see is, are one-strap masks considered respirators? Well, we certainly know that dust masks are. NIOSH and OSHA consider dust masks a respirator. The key with any dust mask is that it is NIOSH approved. So if you're going back to your workplace and you're wondering, are we wearing appropriate dust masks? and they are in fact respirators, also called filtering face pieces, take a look at the literature, at the box, at the packaging that dust mask came in. And if you don't see NIOSH approval on there somewhere, then it's possible that you're wearing a cheap knockoff. And we want to make sure that any filtering face piece dust mask that we give employees is in fact a NIOSH approved dust mask. So yeah, so it's a quality of the mask, little single strapper, not so great. It's got a nose pinch so we can get a better seal, so that's good. Facial hair is a problem. Gio, do you see anything else here?
I don't know. It looks like the goggles could move around and.
Yeah. I like where you're going. Right, the safety glasses. So these are these big old monster, what they call visitor safety glasses. And sometimes these are worn by individuals who have their own prescription eyewear that they wear underneath these safety glasses. And it's not a bad use for them. But in a case like this, you're right. You can see the bottom lens. You can sort of see the bottom lens of that safety glasses underneath the dust mask. Does that compromise the seal? I'd be concerned about that if this was a potentially hazardous exposure. So yeah, I would wonder about that as well. And you know, I'm looking at something else here too, Gio. Do you see this temple bar going underneath the hearing protector?
Yeah, but does that affect the respirator?
It doesn't affect the respirator, but I would sure be asking questions about how effective this hearing protector is. Because this muff, in order for it to seal properly, it's got to get past all this hair and everything else. But one of the problems with when we wear protective eyewear with hearing protectors is that we can, if they're muff type hearing protectors, we can compromise the seal of that hearing protector. And so it's not going to be doing as good a job. So when I look at a picture like this, I'm looking at, let's get some shaving going on here. Let's get a better dust mask and maybe some eye protection that's not going to potentially affect the seal of the respirator or the seal on the hearing protector. So thanks. Appreciate your input, Gio. So it's time for poll question number 2, Gio.
Employers are often guilty of the following common mistakes in using respirators in the workplace. Ladies and gentlemen, go ahead and cast your votes. Okay, let's go ahead and close out. I'm going to share the results here. Okay, Glenn, we had 2% select using the wrong type of respirator, 2% selected failure to implement a respiratory protection program. We had no one selecting no cartridge change-out policy. We had 93% select all of the above, and 2% selected none of the above.
Well, congratulations to those that chose D. And for the majority of you, you're right. But, you know, certainly when you're looking at these potential mistakes, it's the wrong type of respirator. Yeah, it's failure to have a respiratory protection program when one is needed. It's not always needed, and we're going to talk about that. But it's also not having a cartridge change-out policy, a key feature of the respiratory protection standard. So it's D, all of the above. Thanks very much, and congratulations, everyone, for having that. So when we look at the 5 most common mistakes, it's not understanding the difference between the voluntary use of a respirator and required use of the respirator. 2 very different things with 2 very different paths towards compliance. And we're going to talk about what those are. And oftentimes respirators are handed out without truly understanding the hazard for which the respirator is being provided. And maybe it's not even using the right type of respirator. And if you're going to use cartridges, having the right kind of cartridges on that reusable respirator. Like I said before, a respiratory protection program has a variety of required elements. And it's very important that someone has their arms around all of those requirements and to make sure that they're written into your program. There are 5 or so elements that are really important. And it's really not maintaining the respirator. So we give respirators out, good faith, employers trying to do the right thing, but it's the back end of respirator use that we often miss, and that is caring for the respirator, making sure that it's properly maintained. So let's talk about those things real quick here, and we're going to look at first this issue of required versus voluntary. When we say that respirators are required, we're saying, and we're asking an employee to wear a respirator because we're saying there's hazards that are significant enough in this operation that you need to wear a respiratory protection. When we say that, we're saying a few things. One of those is that we've understood, we've quantified this exposure risk. Either we've had a professional come in and do air sampling, or we've had professional guidance and assistance in estimating what that exposure risk might be. And as a result, we're saying that the exposure risk is great enough to require respiratory protection. And remember, OSHA has very specific exposure limits. Go onto the OSHA website and look at table Z1, and what you're going to find is you're going to find a list of chemicals for which there are exposure limits, whether it's toluene or xylene or benzene or formaldehyde, any number of chemicals. There's very specific limits about how that dictate how great a concentration an employee can be exposed to over an 8-hour day. And sometimes that time limit's a little bit less depending upon how severe the exposure might be. And we're also saying, too, that when we're requiring respirators, we've gone in and taken a look at the process. And really, there's nothing else that we can do to button it up or to mitigate those exposures, to reduce those exposures to some level below the exposure limit. So when we're requiring respirators, we're saying that we know what the hazard is and that there's not a whole lot we can do about it, or we've done everything we can to reduce it. And we got to have a respiratory protection program, and it's got to include all the elements that we'll talk about here in a few minutes. Whereas when respirators are voluntarily used, then we're saying a few things there too. Where certain conclusions are being drawn. One of them is there is no exposure that requires control. You know, basically, we're looking for comfort protection against nuisance particles. Very common, very common. And we're almost always going to see filtering face pieces or dust masks being used when we're allowing respirators to be voluntarily used. Now, if we're going to use something other than a dust mask, then that requires certain program elements of the respiratory protection program. But when we're only using a dust mask and we're only using it voluntarily, and we've had an assessment, and that assessment's told us, we've concluded that this is not an exposure that requires protection. But you know what? Our employees are more comfortable by giving them dust masks. So then when we do that, then we don't need a respiratory protection program. But OSHA and NIOSH say that if you're going to use a half mask respirator voluntarily, and by a half mask I mean a cartridge-equipped reusable respirator, then you have to have certain elements of the respiratory protection program in place. The one thing you do have to do, though, when you're giving dust masks or filtering face pieces to your employees to voluntarily use, is you have to show that you have provided them with Appendix D of the OSHA respirator regulations. And Appendix D is just a simple half-page document, which I'll show you here in just a minute. It's the one thing that we have to provide employees. But here's the key. You have to be able to demonstrate that you gave it to the employees. So just issuing it to them and saying, okay, everybody's aware of this, I'm giving it to everyone, well, that's a good step in the right direction. But 6 months, a year from now, is that employee going to remember that they ever saw that document? Do you have any record that you actually gave it to them? So when issuing Appendix D, it's a real good idea to have some kind of log that they sign that shows, yes, you issued me Appendix D, yes, I read it and I understand it. And this is all Appendix D is. It's available on the OSHA website. All you have to do, in fact, if you Google OSHA Appendix D, this is what you're going to get. If you want a copy of this and you don't want to go out and get it, you can always contact your ICW risk management consultant and they can provide it to you. I have this available in both English and Spanish. I also keep a version of this document, though, that has an employee sign-off section on the bottom. And I'll be glad to send that up. I only have that in English, but I'll be glad to share that as well if someone wants it. They can always send me a note. I'll be glad to send it to you. So the second mistake is understanding the hazard. Really understanding the hazard that employees are working with. And, you know, there's a key tenet of the OSHA regulations on respiratory protection. That's one of the main things that OSHA is saying here, is that you can't hand somebody a respirator without clearly understanding what it is you're protecting them against. The way you do that, of course, is you go out and do safety inspections. And hopefully everybody here has some form of safety inspection being done of their workplace. And if you have field operations, you should have some documented form for going out to the job site and taking a look at it and seeing Are things being followed the way we expect them to be? Are we staging our materials where they're supposed to be? Are the trip hazards being controlled? Are people using respiratory protection properly as required? And it's also, the safety inspection can help to reveal what people are doing and what they're working with. It's not unusual when doing a safety inspection to find aspects of your workplace that maybe you really didn't know existed. Maybe people are using a cleaning solvent or a degreasing solvent or other materials because it helps them to do a better job. I mean, employees are trying to do the right thing and they're trying to do a good job. And oftentimes they take shortcuts because they think that's going to help the job to be done better or to achieve a higher level of quality. And sometimes that means that they're bringing in materials that you didn't know were there. So do safety inspections, get out there and do that old management by walking around and understand what employees are doing and what they're working with. We can also do a job hazard analysis, which is a very specific look at a particular series of tasks to accomplish a job in a process. And that's a valuable way to better understand the details of a specific job to ensure that appropriate personal protective equipment and control measures are being used to help prevent employee injury. And also process interruption and loss and quality issues. So job hazard analysis can be a real valuable tool. I always like starting with a chemical inventory. It's a real good way to start with a good, clear picture of what's being used in the workplace. And as I said before, sometimes there's things being used in the workplace that some of us weren't aware of. You might have worked in that environment for 10 years, but depending upon what the nature of your job is, maybe you haven't had a chance to really understand what are we using out here? What are the various chemicals that are in use in the processes that can produce chemicals that could possibly be a respiratory exposure risk? So getting a chemical inventory, taking a look at the one you have. If you don't have one, get one. And when you're doing a chemical inventory, it's operational processes, it's maintenance activities, it's laboratory environments, if you've got a research and development area. All of these areas are areas that you want to take a good look at when understanding what chemicals do we have in the workplace. Chemical inventory, can't say enough about it. So in understanding the hazards, we want to first of all certainly identify those hazards. Look at those materials, the tasks, the environment, as we just discussed. What can we control? I always say we've got to solve the solvable, get that low-hanging fruit. Oftentimes we see that the source of some chemical exposures for which we're thinking, hey, we've got to give a respirator to this individual, those exposures are actually a result of poor chemical hygiene practices. We might be doing things with chemicals that we don't need to do. Are we covering containers when they're not in use? Do we have a closed transfer system instead of an open pouring system? There's a lot of things that we can do when we better understand our processes to button those processes up a little bit and maybe prevent the exposures that might otherwise require respiratory protection. And at the end of the day, you've got to understand what that exposure risk is. You've got to be able to quantify it, because the use of respirators is based on very specific things like permissible exposure limits. So to understand whether or not we're being covered by a given permissible exposure limit, or PEL, how much of that chemical can be in the air, we have to understand how much we have in the air. And that can be done, as I said, a couple of different ways. So you walk through and you assess your risks. What are people working with? What are some of the respiratory hazards that might exist? And what form are they existing in? And it's really important that we understand the difference of these terms, because oftentimes we might misapply a respirator based on our misunderstanding of what some of these terms are. For example, I'm going to challenge you to understand the difference between vapors and fumes. Very commonly misunderstood. And when we talk about selecting the right respirator, we're going to come back to that. You go through, you look at how well are the controls working that we have in place. If you have ventilation, is it the right kind of ventilation? Is it local exhaust ventilation? Is it something that can be discriminately used by the employee? They can choose to use that exhaust ventilation or not. Do they have to pull a hood over to their work area? If they're welding, do they have to pull it over in place? If we have that kind of local exhaust ventilation, I challenge you to really understand whether it's being used. My experience tells me normally it's not. When we have controls that are at the discretion of the employee to use, employees are trying to get the job done. They're trying to move through the tasks. And when they do that, sometimes these discretionary controls don't get used. So we want to look at how effective the controls are that we have and whether they're being properly maintained and are they functioning the way that we expect them to. Do we have administrative controls? Do we dictate how long a person can work in a given area? That's one way it's sometimes used to help to regulate potential overexposure. The best thing we can do is perhaps move to less hazardous materials. Sometimes we have a cleaning agent that everybody swears by, and it's hazardous enough that it requires respiratory protection. There are plenty of other cleaning agents out there that have less potential hazardous exposure risk. So we want to really understand what materials we're working with. And as technology advances, there's plenty of lists out there for, quote, green chemicals that can be used to replace some of the more hazardous chemicals that have been used in industry for so long. So really try to understand what you're using, and is it really the best material given the potential hazardous nature of its character. What are the work practices that are being used? When we look, and again, I challenge you, go out to the workplace, look at how employees do their job. My experience has been that oftentimes it's work practices that often dictate what that exposure risk is likely to be. Employees are just tossed in sometimes into a process. They learn from the guy or the woman next to them, and they're just trying to do the job. And sometimes the things that they're learning from somebody who's been doing it for a little bit longer than they aren't necessarily the best approach. And sometimes those work practices are actually creating the exposure risk that otherwise wouldn't exist. So understanding how people do the job is critical. You'll notice that personal protective equipment is the last thing on the list. And if the phones were open, I'd ask you guys, why is PPE the last item on the list? And I think you'd probably tell me, because PPE can fail. It's a tool. It's a piece of equipment like anything else, and it can potentially fail. It also can be misused. And its improper use of personal protective equipment is the one thing that I often see that really compromises its effectiveness. So PPE is often the last thing we want to do, but for most employers, it's their first line of defense. And it's a step in the right direction. You know, an employer who says, I need to protect my employees really does need to be applauded for working in the right direction. But there's a number of things we always want to try to do first before we just put a barrier like personal protective equipment, a potentially ineffective barrier between the employee and the hazard. So again, understanding that hazard first is really the key. And one of the reasons, again, is that we want to understand the magnitude of that hazard because we don't want to give a respirator that's not properly suited for that hazard. It might be undersized. We might not be giving the level of protection necessary. And it might be oversized. We don't want to give somebody a full-face respirator when they don't need a full-face respirator because we know that, as seen like in this picture here, it affects communication, it affects comfort, it causes discomfort, and it can affect vision. You can see the vision is limited. I mean, there's a lot of reasons why PPE can create its own safety hazard. So we only want to use as much personal protective equipment as is appropriate for the hazard that we're dealing with after we've done everything else we can to control that risk. So here's the real meaty part of this, and this is something that we see a lot, and that is really choosing the right respirator and cartridge for the job. And I want to use an example, though. To select the right respirator, I keep talking about the magnitude or severity of the risk of the hazard. Let's look at it in an analogy, in slightly different terms. Let's imagine that we're being asked to move a load. Somebody comes in and says, I want you to move, I got a load in the other room and I want you to move it from that room over to the warehouse. You go, okay, fine, I'll do that. But you have to know something about the load you're being asked to move to understand what is the right tool in order to move that load. Can I pick it up and carry it? Do I need some lightweight little, Office Depot dolly? Or maybe I need a bigger dolly, a better one for boxes and things. Or maybe I need a furniture dolly. Or maybe that load is so great I actually need a forklift. So depending upon the size, the weight of that load that's attempting to be moved, that dictates or determines how I'm going to move it. And the same thing is true with respiratory protection. Depending upon the severity of the hazard, determines the type of respirator I'm going to use. And OSHA says, again, you got to have the right respirator for the job. And they say that if you haven't effectively, I'm going to direct you down here to this last paragraph. If you have not effectively identified or reasonably estimated that employee exposure, that OSHA is saying you have to consider it IDLH. This means immediately dangerous to life or health. Because if you have a potential respiratory exposure and you haven't adequately characterized, you don't know, is it going to kill my employees? Is somebody going to walk into that environment and have that exposure and be down for the count and never come back? It has happened. So that's why OSHA says that you have to effectively understand the hazard. Otherwise, if we walk in the door and you haven't done that, we're going to cite you for having an IDLH atmosphere. And that's no fun. So let's real quickly look at respirator types. And they come in two general flavors. Then we have this whole air supplying group, and we have air purifying group. So in the air supplying group, you know, this is a no-brainer, right? You're taking your air in with you. You know the quality of the air. I'm going into a hazardous environment. I'm going to take that air in with me. I'm not going to rely on purifying the air in that environment. And that's what firefighters do, et cetera. And we'll talk about that a little bit here. But air purifying respirators, it says that the quality of the air, other than the contaminant that's in it, is fine. So I'm going to wear something that's going to remove that contaminant or reduce its concentration so that I can breathe the air that's there. Clearly, one of the features to make this work for us to be able to use air purifying respirators is that the air that's there, other than contaminant, is good quality air, meaning mostly that it has an adequate oxygen content. We can really run into problems when we're giving somebody an air purifying respirator and asking them to perform an operation in a confined space, for example. Because in a confined space, any number of things can happen. It can already be oxygen deficient. We might do something in that confined space that creates an oxygen deficient atmosphere. So we want to really understand what we're doing and where we're doing it when we're offering air purifying respirators. Most of the time, an air purifying respirator is going to be fine in most environments, but you have to do that hazard characterization. When we're looking at air supply respirators, we see there's SCBAs, and there's also airline respirators. SCBAs are commonly worn by emergency responders, firefighters, etc. They take their air in with them. They're not dragging a long airline behind them. They're going on in, they're doing what they need to do, and they're getting out of there. Whereas an air supply system like an airline respirator, we've got a long line that's attached typically back to an air tank. Now, most folks aren't going to do this. If you're doing some confined space work, maybe you've got people wearing airline respirators. And if you do, then you probably have a very robust respiratory protection program. One of the again, failure points that I sometimes see with employers, well-meaning employers who want to have employees who are qualified to respond to an emergency situation, an emergency spill. Maybe you have large volumes of chemicals at your facility. And so somewhere on the wall is going to be a little cabinet. Inside that cabinet is going to be an SCBA. And maybe 3 or 5 years ago, some, again, well-meaning member of leadership said, yes, let's do this. Or maybe their safety person said, yes, we need SCBAs. Unless you have a strong, robust, ongoing program where you drill, where you test, where you train, where you get these things out and use them, I strongly encourage employers to not have SCBAs on the wall. If there's any alternative to having to emergency response, and typically there is, you've got a local emergency hazmat team with your fire department, but we want to really be careful if we've got SCBAs in our environment because it requires a lot of work for us to be able to safely use these. The last thing you want is for an employee who doesn't quite understand its proper use to put it on, to wear it, and go off into the work environment and into a hazardous environment and not use it properly and succumb as a result. So we want to be really careful about airline systems. One of the reasons, of course, is they require specialized breathing air. We have to know where we're going to get that breathing air and how it's going to be used. If we look at just general air purifying respirators, we're going to look at the 3 most common types here. We're not going to look at powered air purifying respirators. This is an excellent type of respirator, but it's kind of specialized and it's used in certain environments. I've seen it a number of times, and they can be very effective. But if you have any questions about powered air purifying respirators, you're always welcome to shoot me an email or give me a call. I'd be glad to talk to you about where they can be used and some of the benefits of using them. But let's look at the 3 most common types that we use. And it starts with a filtering face piece. And here's where I say you really have to understand the terms that apply to the contaminants that we're protecting people against. This filtering face piece is excellent against dust, mists, and fumes. It says so right on the package. And that's why it's important that we understand the difference between fumes and vapors. We've all said it. man, I was so low on gas last night on my way home, I must have been driving on fumes. And oh man, when you close that container, the fumes are just, horrible coming off of that thing. That's really a misuse of the term. A fume is a solid particulate. Liquids produce vapors. Gasoline produces vapor. Fumes are a dust particle. Fumes are actually particles that are produced from a couple of different sources. The most common source of fumes is welding. When we weld, we're vaporizing that metal. As that vaporized metal goes into the atmosphere, it recondenses very quickly into ultrafine particles. Those are welding fumes. When we burn plastic, for example, it can have the same properties. It can do the same thing. It can produce little fumes in the air, ultra fine condensed particles in the air. And those are fumes. And that's what this filtering face piece or any kind of filter is going to be effective against. Dusts, mists, because mists are little droplets, so we consider those kind of particulates, and fumes. So we want to be very careful when we're using this, and that we're only using it against those materials for which it's rated. If we have vapors, though, we've got a liquid that's producing some kind of vapor that we want to protect people against. That's when we start looking at cartridge-style respirators, either this half mask or this full face. And you can see this full face is equipped with little places to put attachments for respirator cartridges. And these cartridges come in a variety of forms, and we're going to talk about those in a minute as well. Now, these respirators are ordered in terms of their magnitude of protection. So when we start looking at this spectrum, we can see that this is our lowest level of protection. This is our highest level of protection of these three respirator types. One of the things that you're going to see is that the dust mask and the half mask both have the same rating. And that rating is called a protection factor, or otherwise known as an APF, an assigned protection factor. And the reason that exists is so that if, let's say you're going to go in business and you're going to make dust masks. Well, OSHA and NIOSH specifically says, for you to market a dust mask, you have to have it tested, and they have very specific protocols. You have to have it tested, and that dust mask has to be capable of providing a protection factor of 10. And what that means is that if I wear a dust mask, then there's going to be 10 times fewer goobers, fewer particles, whatever it is, inside the mask than outside the mask. So if there's 100 micrograms per cubic meter of some particulate in the air out here, and I put on a dust mask, this tells me that I'm going to have as much as 10 micrograms per cubic meter inside the mask. So these respirators all leak. That's a very important thing to understand. When we wear a respirator, it's just reducing the concentration of materials to the protected individual. It's not eliminating them. So when we start thinking about the use of respirators, we always have to understand that they are rated by their performance. And you can see a full face has a protection factor of 50, meaning there's 50 times less inside the mask than outside the mask on average. That's the level of protection that has to be capable of providing when properly worn, which is why we can't have facial hair when we're using tight-fitting respirators or if we're required to use a dust mask. Clearly, if we have a hazardous environment, a super hazardous environment, then we're going to have a much higher level of respiratory protection. We're going to start seeing protection factors at 1,000 or greater, depending upon the type of air supply system that we have. We talked about choosing the right respirator based on the hazard. The greater the hazard, the higher the level of protection that we need. But we also have to make sure that we're choosing the right respirator cartridge. It's another area that people get into trouble because maybe they're protecting against acetone, maybe they're protecting against formaldehyde or ammonia. Two very different kinds of respirator cartridges are necessary for those different vapors. And you can see that these are examples of cartridges all show something interesting, and that is that they're color-coded. And as we're going to see here in a minute, those colors tell us what this cartridge is good for. Some cartridges are stacked cartridges, or what's known as combination cartridges, and they can provide protection against multiple agents. And when we look at cartridges, we can tell, like I said, a lot by their color. This magenta color, that's a filter. This is a good example of a HEPA filter or HEPA filter, also known as an N100 or P100 filter. And that means that it's capable of stopping a really, really high concentration, a really high percentage of particulates down to a very specific size. And the reason I mention that is because when we give somebody a dust mask and we give them an N95 dust mask, it's important that we remember that it's not providing the level of protection that a HEPA or HEPA filter is providing. This is much higher rated. If we want to give a dust mask that's properly rated as much as a HEPA filter, then we have to provide what's called, instead of an N95, we have to ask our supplier for an N100. There's also an N99, but go for the N100 or the P100 mask. It's going to be rated at a much higher level, that with the same similar level that we would get from an appropriate filter like this cartridge. But when we look at cartridges in general, we see that they're color-coded depending upon what they're providing protection against. So just make sure that you got the right cartridge for the right job. You know, another really important aspect of cartridge use is that they're changed out when they need to be changed out. Look at this half-mask respirator down here, and what you see I've got, let's see, this is a black cartridge. So thinking back, what was black? Black was organic vapor. And we'll go back up and take a quick look. Yep, sure enough, look, black is organic vapor. So I know that when I'm using a cartridge that's got a black band on it, that's telling me it's good against just general organic vapors, like acetone, like hexane, toluene. When we see this little plastic cover over the top, this cover is used so that we can adapt a filter on the top of this. So now, in order for air to get in through the cartridge, it's got to pass through this little pancake filter first, then it goes through the cartridge. Now, how do I know when this pancake filter is filled up with debris and particulates and nastiness? It gets harder to breathe, right? That is not the case when this organic vapor cartridge becomes overloaded with organic vapor. Once all of the organic vapor molecule binding sites, once this thing is full, then it doesn't get any harder to breathe. The problem is now the organic vapor just passes through right into the breathing area of into the inhalation of the person wearing it. So what are they going to do? They're going to taste it. They're going to smell it. And OSHA says no. OSHA says we want to make sure, and we all want to make sure, that we're changing out these cartridges well before they ever get full, before this pancake filter gets overloaded, before this thing becomes saturated with organic vapor and starts letting it pass through. And the way you do that is by setting up a cartridge changeout schedule. Now, it used to be that OSHA said, yeah, you can wait till you taste it or smell it, but they got smart and said, no, we can't do that anymore. So now they say you have to have this schedule. So to set up a schedule, it's relatively straightforward. You can be very conservative, and you can say that, you know what we're going to do? We're going to just make sure that we're changing out this cartridge at the end of every day. Or, well, we're only using it for 20 minutes a day, and we're doing it about 3 times a week. So at the end of the week, we're going to change it out. But you have a really conservative change-out schedule. The alternative to that is that you can go on to the 3M website. If you go onto the 3M website and you look for their cartridge change-out schedule, they have an electronic tool that you can use. And you put in what you're working with and basically how much of it is in the air and the respirator that you're using. And they'll tell you how many hours you can use it before, and what the workload on the person is, because you're breathing really heavily and you'll be pulling a lot more air through than a real sedentary job that the person doesn't have to work real hard at. So once you put all those things into this calculation, it'll tell you how many hours you can continue to use this cartridge before it has to be changed out. And there's a number of these tools out there. You can go to the NIOSH website. They've got a really cool thing called the Multi-Vapor E-Tool. That's, again, a really nice tool that you can use to determine cartridge change-out schedule. You have to have one. If you've got a respiratory protection program, if you're using cartridge-style respirators, you have to have a cartridge change-out schedule. And again, you can do an estimation, and you can be very conservative, and you can say, we're changing these out well before they're saturated. We even got a hold of ICW's risk management team, and they took a look at our documentation for this decision, and they've agreed, they've supported it. So you want to have documentation that shows why you chose the schedule that you did. And one of the best ways to do that is to use one of these e-tools. I also recommend that you have some kind of marking system. You have to know, when was this cartridge put on there? Don't wait until it's so messed up with debris and glue and paint and everything else that we look at it and go, well, maybe it's time to change it. we want to have a very clear cartridge changeout system that tells the person wearing it how often to do it. And you got to make it easy for employees because they're busy working. They're busy trying to get the job done. So let's make it easy for them by having a very simple cartridge changeout process that helps them to be successful in changing out these cartridges when necessary. We put a respiratory protection program together. You got to have the required elements. And that includes things like this. When you give an employee a respirator, not one size fits all. So if you're giving me a respirator, you can see here in the fine print this says small. So if this is, and I think this is an MSA respirator, I recognize the speaker diaphragm down here, is that you might want to offer a small, medium, and large of MSA. That way I can, when I'm fitted, I can put on the right one. You have to make sure that people get medical clearance, and medical clearance is pretty straightforward. It means that you have to have the OSHA questionnaire done. Now, your occupational healthcare clinic oftentimes is equipped to help you with that. You can also go online. There's companies like 3M and others that offer an online medical clearance tool. What that means is that you put your employee in front of the computer and you have them go online and they complete their OSHA questionnaire, and it's confidential. And then that company, like 3M, has a licensed healthcare professional review the questionnaire and determine whether the employee is qualified to wear a respirator. If not, then they'll direct you to have the employee go to the clinic to take a look at what some of the concerns might be. Maybe they answered that one of the questions that indicated that they might have a compromised respiratory system. And so before clearing somebody to use a respirator, they want them to have a further look by a medical professional. A person has to be fit tested, and that can be the qualitative fit test with irritant smoke, or banana oil, or saccharin, or whatever you want to use, done by a qualified person who's had training to do that fit testing. Or you can have someone come in and do quantitative fit testing, where they actually hook the respirator up to a little device called a quantitative fit tester that will determine whether that's the appropriate fit for the individual. Your respiratory protection program has to have some kind of procedures. And it's not necessary to get crazy here and have a whole book of procedures, but you've got to be able to show in your respiratory protection program why you're using a respirator. Where are we using it? What are our processes for making sure that employees are properly using the respirator, that the respirator is being maintained, it's being cleaned, it's being stored? Those are the kinds of procedures or notes that you should have in your respiratory protection program that describe how, where, and when we're using respirators and how we're maintaining them. Certainly, you're providing employee training, and we want to make sure that employees are being properly trained. That's a key feature of the respiratory protection program, is that employees are being properly trained. So we want to describe that training program. It's got to be done initially when they first show up for the job, and it needs to be done annually thereafter. If you have somebody come in to do fit testing for you, it's not uncommon for them to say, oh, while I'm fit testing, I'll also do training. Well, that's great, because one of the things they can do is they can provide training on how to properly use a respirator. The downside, and I strongly encourage you to consider the downside, is that they probably know next to nothing about how your respirators are actually used on the job. And that's a key part of training. If we're truly using respirators to help people be successful in doing their job and to go home safely at the end of the day, then we also want them to understand when we're providing training the hows, the whys, the whens of using respirators in that work environment. And then the simple part is program evaluation, periodically. Annually, when you're doing your annual training, just use that as the opportunity to go back, review your program, make sure it's still doing what you want it to do. There's no new areas that we're using respirators, that I need to change my procedures. We're not doing a different kind of fit testing. Make sure that program is still up to date. And if it is, then you just date it and sign it showing that you evaluated it annually. So the last thing is proper maintenance of the respirator. You know, it's really easy to walk into a workplace and see respirators just laying around, maybe not even being used properly, not being cared for. We want to make sure that respirators are being adequately cleaned, that if the exhalation valve is being inspected, you have a way of changing it if necessary. This is a key thing between the individual wearing this half mask respirator and the contaminant. So we will always make sure that that thing is being properly cared for, and that includes cleaning. Are we giving people wipes to use, or are we giving them the opportunity to give that respirator, that reusable respirator, a warm bath? Dust masks we just toss out at the end of the shift or the end of the day. I strongly encourage you to not reuse dust masks. And where do we store the respirators? Maybe after it's clean, after it's dry, we can put it into a storage bag. That's great. Or better yet, a crush-resistant bin like this. You know, if you are really interested in committing to safety and understanding respiratory protection requirements, and that's what this whole thing is about, properly and appropriately executing respiratory protection in your workplace, that's going to lead to a healthier, more productive workforce. And it's what we're all after. We're all in business to be in business, to have a healthy and productive workforce, and to have a sustainable business that's progressively getting better. And we got to have that competitive business advantage. We do that by preventing loss and having good, strong programs. So having said that, I'm going to show you real quick that there are resources you can access on the ICW website. You can go to RMRX. If you haven't been there, ask your risk management consultant for access to RMRX. Give that person a call, and they can help you navigate the system. And you can find a lot of things on the system. Anything you want to know about respiratory protection, go onto the OSHA website, do a simple Google search, and you can get all the information you need. If you want some help with that, get a hold of your risk management consultant or me, and we'll be glad to help you. So, Gio, what do we have in the way of questions?
Okay. Well, Glenn, first of all, I want to encourage the audience to type in any questions that they may have at this time. We're not going to get to all of them. We're just going to have a few questions to cover. What we're going to do is we're going to take all those questions, and then, Glenn, I'm going to have you answer them. And then we're going to post it when we post the on-demand version as well.
Oh, great.
Okay. All right. So let me get to the first question right now. And a lot of people are asking it. Is this being recorded? Of course, this is going to be recorded. Everyone will be receiving an email when it's available on demand, so that way you'll be able to share this with any employees that missed the webinar. Next question. Can you repeat the information about dust mask approval and maybe cover where the approval comes from?
Dust masks are, as any respirator, is approved ultimately by NIOSH. For someone to offer respirators for use in the workforce in the United States, that respirator has to be NIOSH approved for it to be legal. It's not uncommon to find it, like I said before, a cheap knockoff, but you want to make sure that your respirator is NIOSH approved. If you have any questions about that, then you can take a look at the box or the packaging. There should be somewhere on the box of the packaging, you're going to see NIOSH approved or NIOSH certified, something relevant, and typically a certification number. And if you don't see it, then call the manufacturer, call your source for the dust masks that you're using, and you can obtain it there. If you want some help ferreting that out, if you want some help kind of doing a little detective work to dig into that, you can always give your risk management consultant or me a call, and we'll be glad to help you out.
All right, thank you, Glenn. So, Glenn, you said that dust masks can be voluntarily used for protection against nuisance particles. What about nuisance odors?
That's a great question. You know, I have certainly seen workers wearing dust masks because there were nuisance odors. And it's weird because there's a sort of placebo effect. People think that they're getting protection. And when in reality, vapors, of course, are passing right through that filtering mechanism. You know, maybe some are kind of saturating the filter, but the reality is that they're by and large just passing through that filtering mechanism. Fortunately, there are dust masks available for nuisance odors. And I'm going to show you just a really quick example of that. Hold on one second here. I'm going to drag this on over. And just all you got to do is go do a real simple little Google search, and you'll see that if I looked at protection against nuisance odors, what I'm going to find is that I've got companies like 3M and Moldex who are making dust masks that, at least in 3M's case, it's impregnated with activated charcoal. And the purpose of this is to provide protection against, as it says, nuisance odors. So you want to be really careful when you're using a mask like this, because you want to be sure that the exposure risk is not great enough that you really should be using a cartridge-style respirator with organic vapor cartridges. And again, since this is activated charcoal, the only thing it's going to stop is organic vapors. and possibly some acid gas. The research that I've done has suggested that it can be mildly effective against nuisance acid gas odors. But I would stick with organic vapors. Make sure you know what the person's working with and the concentration is low enough that this can be voluntarily worn. And OSHA's fine with that, with this being voluntarily worn as long as you can demonstrate it's only nuisance level materials or nuisance level odors.
All right, Glenn.
Okay, any other questions?
There's a few, but we're going to do one more. Our employees wear dust masks for certain benchtop cutting and grinding tasks that can produce low levels of dust. Do we still have to do a hazard assessment?
Sure. If I'm in your place, I'm going to want to have something in my files that demonstrates that we considered the respiratory exposure risk of that operation and that we determined that it was low enough to warrant dust masks, so that dust masks were adequate protection. And you can do that. You don't have to do air sampling, but you can do that by having somebody who's professionally qualified. And there may be somebody in-house that you have. You might have somebody who's an engineer or somebody who's been a safety person for a while or somebody who understands exposure risk, who understands respiratory protection. And that person can perhaps make a qualified determination or judgment, or you can get a hold of your ICW risk management consultant, and we can help you with that as well. But like any use of personal protective equipment, let's remember that OSHA has a very specific personal protective equipment regulation. And the key feature of that regulation is that basically there should be no employee wearing any kind of personal protective equipment for which there hasn't been a hazard assessment. And that doesn't have to be a big formal process. Somebody went out and said, yeah, look at this. You're grinding. Here's a face shield. Boom, done. Hazard assessment done. So hazard assessment can be a very simple process, but it's really got to be done. And we're usually doing it whether we know it or not. It's got to be done every time we give somebody any article of personal protective equipment.
We're going to go ahead and close out the Q&A session right now, but Glenn, I'll go ahead and hand it back to you for any closing remarks.
I want to thank everyone for your participation, and certainly just the fact that you are here puts you in the position of being a decision maker. You have the ability to go back to your organization and help to affect change. And change isn't easy. Ask anybody like your ICW risk management consultants, oftentimes who've worked in industry for years, as I have throughout my career. And oftentimes it's tough because you're going against legacy, you're going against institutional norms. But change is necessary for any organization to continue to grow and to be relevant. You have to be willing to accept change. And we're all change agents. That's what we do. So let's go back and let's make change. And sometimes that change means just making sure that we're doing the right thing so that people are going home safely at the end of the day. And we're avoiding loss, we're avoiding legal trouble. So thanks very much. Do appreciate your time.
All right. Thank you, Glenn. Ladies and gentlemen, this concludes today's webinar, Breathe Easier Respiratory Protection. So thank you and have a great day, everyone.